Now, if you've tried every reasonable treatment for your chronic pain or chronic condition and nothing is fully held, I want to tell you something it took me 25 years in clinical practice to figure out. I'm a doctor of Oriental medicine. I invented a medical device the FDA cleared. I trained many other doctors and acupuncturists how to treat chronic pain. I built a free resource called the Awaken Your Inner Healing Power Toolkit for people in exactly this situation. The link is in the description below. Grab it now. I started my acupuncture practice in the 1980s in Westport, Connecticut. I had what you would call beginner's luck. People came in with chronic pain and difficult conditions, and I was able to help them. Most of them got better. Some of them got dramatically better. But by the standards of how this profession measures success, I was succeeding back in 1987. I developed an electronic medical device of my own. It was called the Accutron. I built a company around it. I added energy-based modalities to my work, microcurrent, color light, sound therapies. I started working with the chakra system in chronic pain treatment a few years later. I toured the United States teaching other acupuncturists, doctors, and estheticians how to use these methods. The techniques worked. My results got better. People who had been suffering for decades started getting relief. I couldn't have given them that in my first 5 years of practice. I had built the career most people in my field would have called the goal. And inside that career, something was eating me. I want to say this carefully. Now, that's because it took me years to admit it out loud. Even with the better tools, even with the device, even with the energy methods, even with everything that I had added, I could see a deeper hunger in my patients that even all my best methods and techniques and advanced equipment could only partially address. Now, I was a very competent practitioner, and there was a layer of what was hurting people that I was not reaching. And this hurt me. I knew the pattern was considered normal in my profession, but I wasn't satisfied with it. So after more than 2 decades of this, I stopped being able to motivate myself to do the work. I lost motivation to keep treating symptomatic issues, knowing that they were the tip of the iceberg, and I was rarely getting to the deeper part. So for a time, I grew kind of despondent. I lost my motivation. I had what I now look back on would describe as a quiet collapse. I was still showing up to the clinic, I was still teaching seminars, but internally I was done. I'd hit the wall of my own training. So that's when I booked the retreat. I did not go to Guatemala looking for an answer. I went because I didn't know what else to do. I checked out many different possibilities, and that's the place I was led to. The center sat on Lake Atitlan, which is one of the most quiet, beautiful places I have ever been to. This retreat included 2 ceremonies with 2 different local Mayan shamans on different days with a translator. I didn't really know either of these shamans. They didn't know each other, and they didn't know me. They had no shared notes. They spoke a language I don't speak. But separately, both of them, in different sessions, told me through the translator the same essential thing. What they said was that there was a bigger picture for my life and my healing work than I had been able to fulfill so far. They told me that I'd been out of touch with parts of my own spirit and psyche, that I needed to break out of self-imposed limitations. Both of them used the same phrase. They both said I should work with plant medicine. Now, I am a clinician. I'm trained in herbal medicine. So when I heard plant medicine, I thought they were referring to some kind of folk herbs that grew in Guatemala. So when I went home, that's what I believed. That's what I told myself that they meant. It was only after I left that the translator pulled me aside and explained they were not talking about herbs. They're talking about a specific kind of ceremonial medicine that's used in healing ceremonies in their tradition, and that's spread internationally over the last few decades. I'm not going to name it on this channel. If you know, you know. If you don't, you don't need to. What matters for this video is what happened next. A few months later, I was back in my clinic in Mill Valley, California, troubleshooting an Accutron device for a woman named Lily who had flown in from Hawaii. We were standing in my office working on her equipment when I asked her what kind of work she did, just kind of conversationally. She told me that she and her husband led the exact kind of ceremonies the shamans had pointed me toward. They led them in California, right where I lived. I had a body rush. The kind you cannot fake and you cannot manufacture. I knew in that moment that this was the thing the shamans had been pointing at, walking right into my own office. So I did go to a series of ceremonies with Lily and her husband over a 10-day period in Southern California. I'm not going to describe those experiences in detail in this video. They were the most disorienting and clarifying 10 days of my life. But what I will say is that the message those two shamans had given me in Guatemala came back with force. The message was that I had been living in a box of my own making, that I'd built the box very competently, and that the Accutron company, the seminars, the FDA paperwork, the clinical practice, the income, all of it was real, and all of it was a fraction of what I was meant to be doing. I'd been living a fraction of my own life, and what that really showed me was that I was moving kind of more in the direction of declining at that stage. In other words, I was losing energy. When I really saw that, that was really painful to see. So when I came back from Southern California, I started dismantling things. I cut back the company, I cut back the teaching, I stopped traveling the country with the device, even though it was paying me well. I started studying with a series of advanced healers in the United States and in England. People who worked at a level my clinical training had not given me the language for yet. I had a felt sense that there was a deeper layer of what was going on with patients, and I needed to find teachers who lived there. Now, it took me years to integrate it. I'm still integrating it. But the practice I run now is not the practice I ran in Westport in the 1990s. The patients I see now are people who already have been to the other doctors. They've already been to the other acupuncturists. They come to me having tried everything reasonable. And the work I do with them is no longer about a symptom and a technique. It's about something I learned how to see only after Guatemala. Now, I tell this story because I think a lot of people watching this are at a version of the same ceiling that I was at. Maybe you've been a patient who's tried everything reasonable and still has the problem. Maybe you're a practitioner who got good at your craft and quietly hit a wall, or you might say a ceiling. Maybe your version is something else I haven't named yet. Whatever it is, the ceiling is real. There's something on the other side of it. And you're not the only one who has stopped being able to pretend. The shamans were right. I was in a box. The box was made of my own competence, my own skill set, yet that was not seeing the bigger picture. So if any of this is hitting close to home for you, patient or practitioner, tell me in the comments. Tell me where you are in your own version of this story. I read them. And again, you can get your Awaken Your Inner Healing Power Toolkit. The link is here in the description. That's your first step. Now, next week, I'm going to tell you exactly what I started to see in my Westport practice that made me stop trusting the standard treatment model. Now, if you ever had a symptom go away and then see the same thing show up in the same place or maybe in a different place, that's the video to come back for. I'll see you then.